I've worked at LSU for 2 years. I'm an oncology technician, specifically doing radiation oncology. I operate this machine, which is called the linear accelerator. I also monitor all of our patients under anesthesia. Everybody has to be under general anesthesia for radiation treatment, as well as staging patients, helping with physical exams, analyzing records, and we also set up for radiation therapy planning with our CT machine in radiology. So there's a teaching role with the veterinary students for sure, teaching them specifically technical skills on my end. And we also get into how radiation works, how the machine works, why we would radiate some patients over others. Client communication is a huge part of our job. A lot of our clients are very frequent flyers with us, so we build up pretty strong relationships with them over time. This machine came from a human hospital. It came from Tulane Hospital. It was used to treat humans. There are no differences between how you would deliver radiation to a human versus an animal, aside from getting down to the nitty-gritty. One major difference is that all of our patients have to be under anesthesia because we can't tell them not to move. One of my favorite things is that we are able to make things better and easier for our patients and our clients. Most of our patients come in here having already gotten the cancer diagnosis from their referring veterinarian, so they usually come in with a certain expectation related to that. We are able to provide them, at the very least, pain relief and comfort. At the most, we may be able to keep their disease in check enough to extend their life by months, years, depending on the disease. So that's my favorite aspect of this job is being able to give people more time with their pets. We are seeing across the entire oncology service anywhere from 15 to 20 patients a day. I may be treating 5, 6, 7 patients on a busy day with radiation specifically. So we start in the morning with all of our patients dropping off, getting histories from our owners, seeing if anything has gotten worse, better, and then the rest of the day is devoted to treatment, whether that's chemo or radiation. I kind of fell into this. I kind of fell into being a veterinary technician, period. I had a friend who was going through the tech program at BRCC, and I had finished my bachelor's degree kind of not knowing what I wanted to do, and I thought that may be something that I could put myself and be good use to, and it just kind of grew from there. I spent 5 years in general practice and then saw an opportunity for me here to help teach new veterinary students and veterinary technicians. And so when I saw the oncology position open up, I went for it, and it had no idea that I would be doing radiation oncology. It just kind of happened. I think the most surprising thing for people, one, is that cancer does not have to be gloom and doom. It's serious a lot of the time, but there are ways for us to manage it. And there are certain diseases, tumors, that we can treat with radiation or chemo, where our patients do really well. Our clients are surprised with most of our patients at how few side effects they experience. Dogs and cats don't get the same side effects from chemotherapy that people do. That's one thing that we have to educate our clients on a lot. They do get side effects from radiation. That's something we have to convey, but a lot of our patients do really, really well, and our clients aren't necessarily expecting that. I like to spend time with my closest friends to kind of keep me grounded and sane. I have one friend that I do a book club with every week. I have another friend group that, we like to go to brunch every weekend and check out different restaurants around Baton Rouge. So really spending time with the people who I'm closest with is important for me.